Hello, I'm Dr. David Santos. I'd love to talk to you about fat transfer. Now, what is fat transfer? Essentially, what happens with aging, as we get older, we lose the fat in our face, and that thinness of the face and laxity of the face is influenced by a loss of fat. Our lips become thinner, the cheeks become thinner, and you just think of grandma and grandpa, their thinning of the face is partially due to the loss of fat. And so fat is not good around the abdomen, around the waist, but it is good in the cheeks, and the fullness of the face is part of what is healthy and youthful appearing. Young kids have very youthful faces, of course, and a lot of that's due to the healthy fat that's in the face. So as we get older, specific placement of fat into the face provides excellent rejuvenation. So what's done with fat transfer is essentially to borrow fat from the lower abdomen. I think this is one of the better places to borrow fat, take fat from that area, a small incision through the belly button, through the umbilicus, and take that fat, process it appropriately, concentrate the fat, and then thread the fat into the specific areas of the face that are of need. Specifically, the more common areas we do fat transfer to are the nasolabial folds, but also the cheeks and the submalar area. And then other areas can also be treated as well. Less commonly, say, the temporal area, along the jowl, and so forth. The lower eyelids is another important area. Commonly, we'll place a Juvederm or hyaluronic acid into the lower eyelids, but fat can be placed there as well. The fat that we use is the fat of the lower abdomen. It has a number of stem cells and growth factors that provide an excellent rejuvenation of the tissue treated in the face area. Importantly, when we're talking about fat transfer, the fat that's utilized is placed in the specific areas of the face, and we need some time for the fat to become perfused with good blood flow so that it becomes more alive and more sturdy. So there is a period of time for the fat to take hold, but we can really provide improvement in the contour. Those cheeks and the nasolabial folds, providing volume to the face is a real key element of rejuvenation. In my book, it's even better than the fillers in so much that it lasts longer. A recent study suggested that upwards of 70% of fat transfer stays for long term. And so we're big fans of that as fillers, which is very common. When fillers are used, they, of course, will absorb over a period of several months. But fat transfer is something that oftentimes can be long-lasting. So I look forward to talking to you about facial rejuvenation and fat transfer and how that might benefit your particular circumstance.